It's a teenager's nightmare, but even adults aren't immune to it. We're talking about acne. And in this week's Your Community Health, WENY's Renata Steele talks with an Arnott health doctor about this pesky skin problem and ways to treat it.
Hello and welcome to Your Community Health. I'm Renata Steele with WENY News, and this week we welcome back to the segment Dr. Amit Sharma here at Arnott Health. And this week we are talking about something that I think almost everyone can relate to. So many people have gone through this at some stage of their life, and we are talking about acne. First of all, Dr. Sharma, what is acne and why is it something that you should treat?
So thank you again, Renata. So I had acne myself, and pretty severe acne, and I know how it feels. I've been through the process and my acne has been successfully treated. It's most common in teens and adolescents, but infants get it, adults have it, females have it, and more women are getting acne in their 30s, 40s, and 50s. And acne is the medical term for pimples, and this includes whiteheads, blackheads, cysts, nodules. And the reason we treat acne is because it can lead to scars if we don't treat it. Mm-hmm. And acne is more than a skin condition. It affects your moods, it affects self-esteem. So we treat it, for your general well-being, mm-hmm. and to prevent black dots and scars.
Mm-hmm. And now if you go to the drugstore, if you open up a magazine, even turn on the TV, there seems to be a huge market for drugstore and over-the-counter options to treat acne. So is this something that people can adequately treat on their own?
Yes, people can, and usually they do. They try some treatment on their own before they see a doctor, and they should. Most of the medicines contain some component of benzoyl peroxide or salicylic acid, and the problem with the treatment is people don't treat it for a long enough time. It takes 4 to 8 weeks for any successful treatment, and compliance is a major problem. And once people see treatment is effective, you have to continue the treatment to prevent any outbreaks.
Mm-hmm. And at what point maybe should you see a dermatologist or a specialist for acne treatment?
So we classify acne based on severity, and it's very simple. It's mild, moderate, and severe. So the mild cases can be done, by the patient. Moderate, severe can be handled by the primary doctor or dermatologist. And so we start off with topical treatments you apply on the skin. This may be antibiotics or combination with antibiotics. And if that doesn't work, we go to oral medicines that you take by mouth. Mm-hmm. And in severe cases, your primary doctor or dermatologist may talk to you about Accutane, which is a very powerful drug. It works pretty well, and it worked for me. But it has some side effects, and the risk and benefit of this drug needs to be discussed with your doctor.
Absolutely. And now we hear a lot about diet and acne, whether certain foods can contribute to acne, or is there dietary changes that can help in the treatment of acne? Can you talk a little bit about that?
Yes, yeah. This is a great question, and I don't have a clear-cut answer. This has been debated for years, and research is being done. So the traditional view is that diet does not affect acne. And there are new views coming out that maybe it does. Certain types of food affects acne, and some people may see a change in their acne based on what they eat. So the importance of diet needs to be individualized. And I do have one final word. So the treatment of acne is an ongoing process, and if patients are willing to spend the time, they will see meaningful results.
All right, very important to know. Dr. Sharma, thank you so much, and thank you for joining us for this week's edition of Your Community Health.
Thank you.